Hey, everybody. Just real quick, thanks for joining and making time for the press conference. I just want to let you guys know we'll get started in just a couple minutes. Please keep yourselves on mute. Dr. Boutros will have an intro, and then we'll get to media questions. I'm asking everybody to use the hand raise sign. It's under reactions, and you can raise your hand like this. And then I'll call on you guys just so that it's a little bit more organized. But yeah, so we'll get started in just a couple of minutes at 11 o'clock. And again, please mute yourselves, and then we'll get to questions after Dr. Boutros speaks. Thanks, guys.
Yeah, you're good. Mute it down.
Josina, I'm here.
Perfect. Hi, Dr. Boutros. Hi, everybody. Thank you for joining again. We will get started in just a minute. Dr. Boutros is here. He's going to give an opening statement, and then we will open the floor for questions. Please use the reactions raise hand function so that there's a little bit of organization and people not talking over each other. And we'll call on you. All right. Thank you. Dr. Boutros, are you willing to allow recording?
Sure.
Okay, because I can't do it on my screen, so you would have to.
Okay, so I will begin recording now.
Recording in progress.
And just let me know when you would like me to start, Rosina.
And I think we have everyone here, so we can get started whenever you are ready.
Great. Well, thank you very much all for joining us. So I know over the past 18 months, we've all been on a roller coaster ride of fear and hope, setbacks and progress. And I know that's our collective effort that really have sustained us. Throughout it all, we've been staying on top of the research, best practices, always focusing on doing what is right for our patients, right for our employees, and right for our community. My team and I, after much research and careful consideration, have decided to require all of our employees to be fully vaccinated against COVID-19 by October 30th. As of today, over 80% of our employees have been vaccinated, and we think it may be even more who have not told us, have not identified as vaccinated. That's a really great start. I know that a small group of employees have not been vaccinated, each have their reasons, whether it's concerns about the safety and efficacy of the vaccine, a matter of personal freedom, or other reasons. And I really do, and my team and the board respect the right to make that choice for themselves. But in weighing our obligation to our patients, our community, and each other, we've decided that if employees choose not to get vaccinated and they don't qualify for an approved exemption, they will not be able to work at MetroHealth. We know the vaccines are safe and effective, and they are our best chance to return to normal. They are also our best protection against the Delta variant and whatever variant the future may bring. We are proud to take this step. Throughout our 184-year history, we have always prioritized patient safety. This is no different. We owe it to all our patients to take every step possible to keep them from harm when they come for a checkup, a procedure, or to fill a prescription. Think, as you know, the American Medical Association, American Nurses Association, American Hospital Association, Ohio Hospital Association, and many, many other organizations have urged hospitals to require vaccinations. Our colleagues, hospitals in Columbus and Cincinnati, already do so. As with the mandatory flu vaccine, there will be exceptions, and exemptions for those who can't be vaccinated for medical or religious reasons. And like the flu vaccines, those who refuse will be subject to disciplinary action all the way up to termination. We don't take this decision easily, and we know we may lose some employees. And I'm going to be very sorry to see them go. But we also know we will attract some people who want to work in a place that prioritizes patient and employee health safety. Our profession, healthcare, has been hailed as heroic because we were there when there was no protection against this disease. We cared for people and put ourselves at risk. We don't have to do that anymore. We can and have to take care of our patients and ourselves. So I want you to know that we thought long and hard about this. Clinical, administrative, and the board stand united around this decision. and we'll be happy to answer any questions you may have.
Thank you, Dr. Boutros. At this time, if you have questions, please raise your hand and we'll start with Lisa Ryan. Lisa.
Hi, Dr. Boutros. I'm wondering if you're concerned about staffing shortages at all if people do choose to leave, and how you might be preparing for that to make sure that your hospital doesn't get overwhelmed.
Lisa, it's always a concern for us, but as I said, we think we may lose some folks. Hospitals have mandated this, have lost very, very few people, but we also think we're going to attract others. We work in a collaborative manner with other health systems. So if there are staff shortages, we will work with them to make sure that the community is receiving the care it needs.
Brian Duffy. Channel 19. I don't know if that's Brian on, but channel 19 has their hand raised.
Yeah, I'm sorry. Yeah, I was muted. Sorry, Dorsina. Dr. Boutros, good afternoon. Good morning. Lisa sort of asked my question about staffing potential problems there. But I wanted to follow up and ask, of the 20% of the people who are not vaccinated at MetroHealth, can you tell me what percentage of those people are directly related with medical care, maybe doctors or nurses? So when we start talking about a potential shortage of employees, are we talking about people who may be directly related to healthcare?
So Brian, everyone is directly related to healthcare, whether you're EVS worker, you are work in insurance department. We can't do what we do without these folks. But I would tell you that most of our clinical staff, and I think that's who you're mentioning, respiratory therapists, physicians, PAs, nurses, and other folks, most of them, we believe, our data shows most of them are vaccinated, even a larger percentage than 80%. But this doesn't only apply to our staff, it applies to contractors, it applies to students and interns, and will also apply to vendors. So we want to make sure that our environment is safe for everyone.
Monica with Channel 3.
Good morning, Dr. Boutros. Have you taken the step for incentives prior to making this? And is there a chance you may, before somebody, adamantly refuses to get vaccinated, if they're offered any incentive?
Yeah, Monica, if incentives make a difference, we will do that. The idea of, and I don't mean to be pejorative here, but I don't think you can bribe people to get vaccinated. Those individuals who don't want to get vaccinated are not going to get vaccinated. There is a recognition program for those employees who are vaccinated, but it's nothing monetary, and it's much more about their ability to move around more freely without masks in common spaces. So we're going to deal with this individually, because I just also don't want to be able to say there's this group of people or this group of people. Everybody who has made a decision not to get vaccinated so far has a reason, and we will work with them, figure out what their support that they need, and we will help them hopefully reach the conclusion that they need to be vaccinated.
Brian, I don't know if you had another question or if your hand was still raised from before.
No, I do. I have a follow-up question. I just was wondering if Dr. Boutros had considered, and he mentioned that he thought that you may lose some people. And Dr. Boutros, a lot of places are finding it very difficult to hire anybody at this point. Have you considered that when you have worked through your process here, that so many companies outside, in and out of the medical community have had a difficult time hiring people?
Yeah, Brian, we will not let fear drive our decision-making process. Our highest priority is to take care of patients and keep them safe. I do not want to compromise that safety and tell a patient is to come to MetroHealth and roll the dice. We're not sure if we're going to pass the infection on to you or not. So we want to do all that we can to do this, and we feel pretty confident that we will be able to convince most of our employees to do that. Houston Methodist, which is much more larger than MetroHealth, had less than it's actually 4 times the size of MetroHealth, had less than 100 employees not get vaccinated. So there is data from other health systems who've required this.
Lydia from Crane.
Hello. I'm wondering that 80% figure that have been vaccinated, how long have you been around that figure? Are you pretty, has that been a plateau for a while? How many folks are actively getting vaccinated among your staff right now?
So Lydia, you gotta remember 2 things. One is that when we started vaccinating, we went like from 0 to 70 very quickly. But we also have about 100 people who come into MetroHealth each month or who leave MetroHealth each month, right? So that many of the people who've left MetroHealth have already been vaccinated, and many of the new people who have come in had not been vaccinated, and we vaccinated them. So the number of 81 or so has been ticking up slightly over the past couple of months. But we went from 0 to 70 very quickly, and then it's been a mild increase ever since.
And I'm also wondering, you have that figure for your caregivers, but then given that you're requiring contractors, volunteers, students, and interns, do you have any sense of how many of the folks that you typically work with in that capacity are already vaccinated?
Yeah, there's to our best guess, there are about 80 to 85% as well.
And how do you plan to navigate accountability there, given that they're not it's not through HR?
Well, we have a registry through our vendor system, and if they don't have proof of vaccination, they will not be permitted into the building.
I don't see any more hands raised right now. Does anyone have any more questions? We have a few more minutes, so I want to make sure that you guys get what you need.
I'll ask one more. When was this announced to internally?
This morning.
This morning. Have you gotten any sort of feedback? Have you heard anything from staff at this point, or do you have any sense of how this has been received within your employees?
So far, 100% of the emails have been positive.
Okay. Any last questions? And just so you guys know, I will send out the recording once I get it, because I know some people wanted permission to record. Sorry, Lydia, go ahead.
Okay, sorry, I had one more. So given the acknowledgement that this could, you could lose a few employees through this process, are you hopeful that some of the other systems in Cleveland will follow suit? Obviously, SUMA did this earlier this month down in Akron. Would you like to see other hospitals in Northeast Ohio also follow some of these associations urging to require their employees get vaccinated?
I think with MetroHealth, about a third of the 30% of the hospitals have made that requirement. So I think you will see that number increase. We were waiting for that one of the vaccines would come off EUA, and that was our decision-making process. I'm sure other health systems are considering their needs and their ability to pull this off. We've always required influenza vaccination at MetroHealth, and have been doing so for over 10 years. And it's an arduous process, but we know how to do it. And we will add that to the list of things.
So I will end up sending out this recording once I get it. Also, the press release, the link that I sent this morning has been updated with a longer video statement from Dr. Boutros detailing exactly what you just heard, but it's, shot by us. So you guys have that as well to use. Any final questions? Okay.
I'm just gonna tell everybody to please stay safe.
Always. All right. Thank you guys so much. Please let me know if there's anything else that you need. Otherwise, have a great rest of the week. Thank
Take
you.
care.
Thanks, you
Bye.
too.
Thank you.
Thanks, Dr. Boutros.
Thank you.
Thank
Bye-bye.
you.
Recording stopped.
Hey, Petey, how are you? Good.